This week, a video came out from a world-renowned biomathematician, modeler, Knut Wittkowski. He came out and there was a 1-hour video out there that was extremely compelling, complaining about the fact that why aren't mathematicians involved in this process? Why was it just virologists and MDs? What does the WHO actually know? Was the imperial model totally off, and how long ago did mathematicians know it? I had the opportunity to sit down and talk to Knut Wittkowski yesterday. Let me just show you some of this guy's credentials so we have a sense of who we're talking about. This is the founder of Asdera, former head of biostatistics, epidemiology, and research design, Center for Clinical and Translational Science at the Rockefeller University, former senior research associate, a biometrician, consultant of the New York Academy of Medicine, associate HIV Center for Clinical and Behavioral Studies, guest researcher, Centers for Disease Control, DCS, Medical Biometry, University of Tübingen, and PhD Computer Science, University of Stuttgart. This guy has more letters around his name and background. That's why what he is saying really, really is so powerful. And it is aligning with, as I told you, there is no longer scientific consensus in the world. And there is certainly not mathematical consensus. And that's what I got to when I sat down and had this conversation with Knut Wittkowski. I hope you enjoy it. You better be ready to take notes. Grab your pen, grab your paper. I think you're about to get a huge dose of what sounds a lot like sense. I want to thank you for taking the time.
My pleasure.
You're kind of an immediate internet sensation right now. You wrote a paper recently discussing what you think might be a better approach to COVID-19. Currently, we are all locked down around the world, different variations of it. I think Sweden is the only nation I know of that actually, has avoided any sort of form of lockdown.
Mm-hmm.
But in your paper, you described what you thought would be the best approach. Could you go ahead and explain that to me? How do you think we should be dealing with COVID-19?
Well, we shouldn't really deal with it. We should just let nature take its course. And the only thing we should do is we should try to make sure that the elderly and the vulnerable don't get in contact with people who could be infected. So they should isolate until the whole thing is over, and that shouldn't take more than 4 weeks. There is no evidence around that doing any of these antisocial separation or prohibition or whatever you call it has any effect on the epidemic. With one exception, it flattening the curve, what people try to do, is broadening it. And that means it takes more time. And if it takes more time, in the end, you are putting more people at risk because nobody can, for extended periods of time, follow these draconic strategies or measurements.
I'm not against the quarantine if there's really, truly a deadly epidemic for some reason sweeping the planet, but we need to right that ship once we've discovered that the death rate's not what we thought it was going to be. Would you agree with that point, or do you think, was there enough of a panic up front to sort of start a lockdown?
Very early on, yes. Very early on, we didn't know anything. But now we have already seen the epidemic in the United States taking half of its course, so it has already peaked. And about 12,000 people have died. Make it another 12,000, that would be 24 or 25,000. That would still be lower than the average number of people dying during a regular flu season.
We are, going into a month now of lockdown or more. We're looking at a few more weeks to say in the end of April. How long would this entire thing have lasted had we gone with your approach and just said, hands off, let it run its course like other flu seasons? How long to reach that herd immunity point in your mind?
It would be over.
We'd already be through it.
Yep. The same way it did in China, it did in South Korea, it did in Australia, it did in Austria. We have lots of these examples. This is what the epidemics do. And there is no reason to expect it would be fundamentally different in the United States. It may take a bit more time because the United States is so big, so the virus doesn't get everywhere at the same time. There's a delay of a couple of days before it gets from one place to the other. And therefore it can take a bit more time, but that's not a major factor in the whole discussion.
We keep hearing about a second wave, that we now have to prepare for the second wave probably coming in the fall. Do you predict that that's something we should be preparing for? And how do you think we should prepare, if so?
We should prepare by stopping the prohibition as soon as possible, and then we have a good chance that there will be no second wave. If there is a second wave, it is because the shutdown was preventing herd immunity to build, and then if the summer is over and people stay more time indoors, then the virus will start spreading again. And the way to prevent that is to let the virus run its course right now and be done with it.
What would be your definition of herd immunity?
That enough people had contact with the virus to be immune. And if the majority of people is immune, then there is no risk for somebody else coming in to spread the virus. And then the epidemic is over.
At what point did you break away from believing in the imperial model? How early on did you start suspecting it was wrong?
From the very beginning, I never believed in it.
Why?
Well, because it didn't make any sense. And the problem is some people put out models that have no relation to reality, and then you can prove everything, including the opposite. We should use models that are actually grounded in reality. And if we do that, we get realistic estimates. They can be 10% high or even 20%, but they will not be off by several orders of magnitude.
When you say proper models or using real numbers, I think around the world we assumed that's what was being used. What were these models built on?
I have no clue, because I couldn't see any information that would allow me to evaluate what type of model was used, other than it started with M and ended with Otto. No qualified or very few qualified epidemiologists were ever being consulted. It was all virologists and MDs, and they are not really trained in understanding the complex nonlinear systems that drive epidemics and that you have to incorporate in your thinking to make sense of the data.
Is there something specific about a respiratory disease that means we should lock down more than other illnesses? Are respiratory diseases more dangerous when we look back historically?
The influenza and coronavirus and other respiratory diseases, they all have very similar characteristics. There's nothing different between this coronavirus and previous coronaviruses, and the epidemic looks very much the same as the epidemic of influenza viruses. It's all the same. They come, they say for a moment, and then they drop, and that happens naturally, and it doesn't really require very much of an intervention.
Deborah Birx is now saying that they are going to put a code, the death code for coronavirus, on every single person that dies with coronavirus, despite whatever, whether they had some other comorbid issues that could have been deadly. Does that make the job harder for someone like you? Does that hurt our ability to really figure out what happened here if we're coding everything as COVID, even if there's a potential they died of a heart disease or a diabetes or something that was surely going to kill them otherwise this year?
Yes, it makes it much more difficult. It's one of the two things that make it difficult. The other thing that makes it difficult is when people are changing the strategy of collecting data in the midst of an epidemic. or changing the definition in the midst of an epidemic. Immediately following that, you see a huge spike or drop or some other change that you know has nothing to do with the epidemic, only with the reporting system.
So when we're looking at these graphs, we do see these dramatic spikes at times, or it goes up, or these high points. Is that naturally how viruses work? Do we see things
No.
spike and then they go down and come back for a while?
No, nature doesn't jump. Darwin said that. Nature doesn't jump. Epidemics go smoothly. They incline, they peak, and they decline, and they don't jump back and forth all the time.
Can you explain to me why we see these spikes in these graphs?
Well, if somebody finds, I said that before, a shoebox with reports that should have been reported and wasn't, and then sends the shoebox in, or scans the data or whatever, then suddenly there's a spike.
Makes sense. Or if suddenly one day you say this is the official code and everybody goes and grabs all their logs and then codes it, we could see a spike there too.
Yes. And we have seen that happen. We have seen that happening in China originally. So they had one of these enormous spikes, and everybody cuts off the graph because otherwise you can't see anything anymore. And then it turned, they changed the definition of what the case is. And actually, they changed it to the worse. And that's now being incorporated into many other strategies, including into what the CDC now advises people, that there should not be a test and an examination whether it was actually the virus that contributed to the death. As long as somebody dies and you find some virus, whether it had an effect or not, it's still being considered a coronavirus disease case, and that is ridiculous, but that's what it is. It makes, as you said, it makes our life much more difficult, but luckily epidemics end fast. So if we can stop the nonsense of the prohibition 100 years after the other prohibition, if we can stop that, then what we will have is the virus will just go within a couple of weeks and it will all be over.
When you look at everything you watch on the television right now, it's saying because of this lockdown, you know, we have been able to stave off the inevitable. Now they're talking about next fall. We're going to have to prepare again. Are you concerned that we have turned a corner into a new way to deal with these viruses that could see us in quarantine more often in the future?
Okay, the first thing is there is no evidence anywhere in the world that a lockdown had any positive effect. Actually, there's a lot of evidence that it is negative, that flattening the curve prolonged it and prevents herd immunity from building up. And if herd immunity is not building up, then whenever you stop the intervention, you see the epidemic do what it couldn't do before, and that is you see the number of infections or the number of cases rising again. Not as high as it before was, but it would rise again, and then people get scared again, and they start the same thing over again. And this is how you create these rebounds and these waves, and you can keep it going for a year or more just by reinstating doing these lockdowns.
So we could be starting a dangerous cycle in your mind?
Oh, if we hadn't done this, it would be over.
When I look at Tony Fauci and I look at Deborah Birx, when I see Bill Gates out there saying things like he wants to lock us down hard for 10 more weeks or something, or that we're going to have to keep using these measures, when you living in this country, what is your thought about that approach? And are you shocked more scientists aren't stepping up to say we need to stop this?
I'm not shocked. many of my colleagues are mathematicians, and they're not necessarily the people who like to talk to the media. So that's one of the problems that we have. So I shouldn't just blame other people. I think I should blame my own profession too. But other than that, politicians should listen to scientists who actually know something about the subject matter that is involved in their decision making. But what I don't understand is why politicians, starting with our president and the New York mayor, until a particular day, what they say makes perfect sense. The president said, this is a flu. The mayor of New York said, closing schools doesn't make any sense. And then it took them the next day, well, different days, but the next day after they said one thing, they made a 180-degree turn and said, okay, let's shut down the whole economy and let's shut down schools in New York. So why do politicians who have been saying the right thing for quite some time, from one day to the next, suddenly change their mind? I have no clue.
You know, I thought at the time Donald Trump was saying this looks like a flu. It looked like a flu to us also, and my team of scientists and mathematicians that I'm working with. But I have to imagine when the head of your health department, or Dr. Tony Fauci, who's been the head of NIAID for, multiple decades, says to you, Mr. President, you're wrong on this. People are going to die. When we're looking at the numbers, we're looking at the potential that millions could die. How does a politician override that type of statement? I mean, that would take, either a personal education we didn't know about or, a really strong sense of opinion, wouldn't it?
I think the only way to protect against is to listen to more than just one or two people. So listen to people who represent different fields and try to aggregate the information that you get and also to question them. It's not about, okay, this is the guy I believe and this is my guru and then I do whatever that person says. It should be about, okay, let's convene a couple of experts from different fields and have a discussion. And I'm not sure that this happened. I haven't heard about this happening.
So am I to understand your concern is that you don't think mathematicians were involved in this process?
I'm not aware of any. Everything I hear, all the people I hear talking are either virologists or MDs. Now, a virologist can tell you exactly how the surface of a virus looks like and many of the other things. I don't want to simplify what they're doing. An MD is trained in making a diagnosis for a particular patient and find the right treatment for that patient. So these are, of course, this is a very much an oversimplification, but these are the key issues that these professions handle. Well, we as epidemiologists are dealt with we learn how to do mathematical models, how to fit them against data, how to make sure that they're the appropriate models, and how to understand the complexity of the non-linear dynamics of that epidemics.
So when we look at numbers, I think that people would argue, you are arguing we should have just let this run its course. And I'll tell you that even on this show, which I know you haven't watched the episodes we've done, it does appear there is a small group of people that are having a very dramatic effect with this illness. And the concern was overrunning New York hospitals. I'm not in New York. I can't get inside the hospital. It looks like they're on the verge of capacity. Wasn't there a real risk that we could overrun that capacity had we just let it run its course, even if it was a small percentage? If that percentage was so acute as it appears to be, would that have been a really dramatic problem? And that's why we decided to lock it down. Go ahead.
It wasn't a real risk. Now, I would like to make one comment and correct something that I don't want to be misinterpreted. I don't say we shouldn't do anything. There's something that's very important to do, and that is to isolate or separate those who are vulnerable, who are old, who have comorbidities. They should stay away from people who could potentially be infected. So they should stay at home. But this is nothing new. In every flu season, we tell the elderly, don't use the subway, don't go by bus, don't stay at home and separate yourself, reduce the exposure to the virus because you are highly vulnerable. So that is something that definitely should take place, and we should do that. The government should pay for pharmacies to deliver all pharmacies. They should pay for food being delivered, for all the services that people are asking for to be able to separate themselves for a short period of time, and that is about 3 or 4 weeks, from the epidemic. That makes perfect sense, and I'm fully supportive of that. However,
Okay.
shutting down schools and shutting down business has nothing to do with it, and it's actually increasing the load for the hospitals. Because if you tell elderly and people with comorbidities to separate, the epidemic is running among the children and the young adults, and they don't need to be hospitalized. They don't need it. They have a minor, either they don't realize anything, or it's a minor thing that happens. Okay, one day your nose is running, or you have a bit of feeling uncomfortable. But that's about it. The hospitals are overrun by the elderly people mostly. So if you separate them, you're protecting the hospitals from becoming overloaded. On the other hand, if you prevent the virus from spreading among the youth, the virus stays there longer and is spreading among the elderly and those who have comorbidities. And in the end, you have more people who are dying than you would otherwise have. And I don't think that's a good public health policy.
We're seeing reports of people being arrested for being out on their surfboard out in the water, or people taking a stroll on a beach outside. They've closed down national parks, outdoor places. What do you think about the approach of keeping people from going outside and keeping them locked in their houses as an approach to stopping this illness?
Okay. The reason that we don't see flu epidemics during the summer is that people spend more time outdoors, or at least that's one of the very big factors. So it is not, respiratory diseases are not being spread outdoors. They're being spread indoors.
It's being reported that I think the Prime Minister of Australia is saying that they plan or intend on maintaining some form of social distancing and locking down until the vaccine is available. What do you have to say about waiting for this vaccine and staying with this approach until then?
I don't understand the whole thing. The first thing is, it's going to take about a year, maybe longer. Everything else is wishful thinking. It's going to take time. So we have to, whatever is being developed has to be tested first for safety, then for efficacy, and then eventually it can be brought to the public. And that whole process takes time. And why you can, I don't see this, and I don't understand how people could even fathom this, that the society is being shut down for a whole year, let's say. Humans are social beings, and to have mental health, they need to interact with other people. And we have now seen that the last month, more guns were bought in the United States than ever before in any month, as long as people are counting guns. Now, just imagine, these guns are now in the hands of people who become less and less stable, more and more depressed, have less and less the possibility to align their thoughts with the thoughts of other people. All of the things that we humans do. What will happen? Eventually, somebody will shoot somebody else because he's not wearing a mask. and I'm not joking. I really think that we have already had, yesterday or the day before yesterday was somebody shot his partner and then himself because his partner was infected with coronavirus. And things like, if we push the whole society into the realm of insanity, I don't think that will be beneficial to the society.
Just because it's the big question going all over the internet, when there is a coronavirus vaccine, will you take a coronavirus vaccine, and why?
I usually take vaccine shots, and I will take that vaccine shot too if it has been tested and shown to be both safe and effective. I would take it like every other flu virus. So in a year or 2 years from now, if people have evidence that the coronavirus is about to spread again, then that should be incorporated into the annual flu vaccine and be used. I don't see any problem with that. I'm taking the other vaccines, I would take that as well.
In a world where most media and virtually every political leader in the world has agreed with the principle of using social distancing and locking down, we still hear around the world that that will be the approach going into the fall should this illness come back. It seems to me that someone of your stature and background is really putting your career on the line to step forward and make these statements that you're making right now. Can you tell me what has inspired you to write the paper that you're writing, to come on shows like this and try and tell people that you think this approach of locking down the healthy? Now, I think you made a really good point. Let's protect the elderly and the immune suppressed. I agree with that. But why are you taking this risk with your career?
I think we, as human beings and as members of society, we have a responsibility. We have the responsibility to do best what we are being trained to do, and that's what I'm doing.
Well, I want to thank you for doing it, Knut. It's really nice to be able to believe in scientists that follow the science, and you don't seem to have an agenda with this. At least when we looked into you, I don't know what you would have to gain. But it's refreshing to hear your perspective. And the truth is you're not alone. There are many, many scientists and mathematicians speaking out around the world on this topic. What would be, if you had, a moment to sit down with Donald Trump right now, what would you want to say to Donald Trump?
I would say we need to reopen schools immediately. That's the most important thing to do. And then we have to reopen businesses to keep the economy going. The initial assessment, this is a flu, is right, or was right. And because it was right, it still is right, and we should treat it as any other flu.
Wow, I mean, that's a powerful statement and testimony by a world-renowned mathematician that has been graphing and modeling his entire life. If you've been watching the High Wire over the last several weeks, you know that there are so many scientists now stepping forward and jumping on the other side of this conversation and saying, we've got it dead wrong. We've had it dead wrong from the beginning. The things that Knut's saying are so powerful. When I think about what he's describing as he said a lockdown is only preventing herd immunity from building up in many ways. And the conversation that I think we all really need to start having, and by the way, you can see how dangerous this show is right now. I mean, I don't know if this is going to stay on Facebook and YouTube. So please remember, if you like the information you're getting and you want to keep hearing from world-renowned scientists, then if you're on YouTube right now, will you go ahead and subscribe? That'll help us promote through YouTube while we exist there. But then take one additional measure after you've subscribed on YouTube or wherever you're watching. Go ahead then and go to our website, thehighwire.com/watch, and sign up to our email list so you'll always be able to find us and this information because it's critical. Now let's get into, I want to get into the details of what Knut was covering in his paper. You heard a lot about his opinion. I didn't have him in studio, so he couldn't go over the graphs. But when you look at the paper that he put out challenging this idea, this is it, the first 3 months of the COVID-19 epidemic, epidemiological evidence for 2 separate strains of SARS-CoV-2 viruses spreading, and implications for prevention strategies by Knut and Witkowski. This was his paper, and in it some really, and you, again, we will get you those details. If you're a recurring donor, it's going to be in your newsletter. If you type in ICAN right now on Facebook, or you text us at 33222, we'll try to get you all this information so you can read the paper yourself. But here is the conversation now we are facing here in America and around the world. When does this lockdown end? How do we avoid more lockdowns in the future? And the biggest mama of all questions, was this lockdown necessary, and was it effective? Did it work? And one of the things, when Knut has been discussing this very issue, we are seeing China now going back to work. They are going back to work, and Knut is saying in his paper the reason is because they have herd immunity. Not the story we were being told by Deborah Birx and by Tony Fauci, that it's because they simply, killed the virus by starving it out and disappearing. He's saying no, because they all got it, that they ended up quarantining too late. Let me explain this by going through the graphs that Knut showed us in the paper, and then I have some groundbreaking ways to look at our new numbers. You are not going to see this anywhere else. Let's take a look up on the board over here, okay? So in the study, in this paper that Knut Witkowski put out, what he said is China did not avoid herd immunity. They didn't stop it. In fact, they have herd immunity, and this is why, he says, if you look at the graph, these are the China numbers graphed out, right? Cases in mainland China, okay? And what he points out in this paper is that you didn't lock down right as this thing was coming up so you could have stopped it from happening. In fact, what we realize is that in the beginning, we look at February 5th, okay? Right here is really that gradual point. Remember, don't look at this point. What did Knut tell us? That evolution tells us that there's no such thing as a jump, that everything happens smooth with nature. It goes up, and then it comes down. Really, really an interesting thought when we think about the nature of all viruses and how they work. So obviously there was some sort of filing thing that must have happened here that popped up on this date. But what we really see here was that this was the peak right around February 5th in China. This was the peak of their epidemic, right? Well, when did they actually begin their lockdown? If you look in the newspapers, you will find out that it wasn't until over here on the 17th of February. This is when the newspapers report that they're shutting down all of the schools. Not here at the peak, but all the way over here. So the virus, as many, many scientists now around the world are saying, it was already in full scale. It was already sweeping through the population, and in fact was even going down at the point with which you finally decided to lock China down. This is why we're assuming now China must know this. They must be saying, we have no problem. In fact, we now know so many people are infected, we probably have herd immunity. We're going back online. That's a serious issue. China is now back onto the racetrack, as I talked about last week. One of the greatest producers and economic empires the world has ever seen is back on the track while we are all still hiding in our houses doing what we believe to be correct. Now, I think that's a really incredible point. He says the same thing about South Korea, but he goes on to say, we're seeing cases in South Korea because they might have quarantined not in time to stop a large infection, but enough to dwarf the power of your herd immunity so that the virus was still hanging around. Now, is it possible this is what was happening in America? Can we say these numbers are so low or the death rate is so low because social distancing or quarantine worked? Here's something I want to point out to you that is also discussed in Knut's paper, that we are now backdating what we know to be true about when people were infected. Remember, we are hearing in science all around the world that they believe that there's a 14-day incubation period. the moment where you're asymptomatic and don't know you have it, until we start seeing your symptoms arrive, okay? So when that's graphed out, let's look at China with that graphed out because it shows us something very important. Okay, this, what you're looking at now, is the date of reporting in China. We just showed you, but we're graphing it out in a different way here, right? This is the date that was reported. But what we recognize is this is when people were symptomatic. This is when we knew that they had the illness. But now we're recognizing that this is really just an echo of what took place. This is when the infection actually took place, which makes it even more clear as we go back that it was back in January that this thing had already spiked in China and hit the top of its line and was plateauing itself, not in February. So if you didn't lock down all the way until February 17th, obviously this thing was everywhere. We knew what it was doing. And this is what is really important, we believe, to start thinking about. And I think you're going to hear a lot more scientists talking about this. We are looking at the echo of what has already taken place. This is dangerous. All of our numbers and our thinking about this have been based in the echo, which means long after you were already infected. Now, we're not the only ones looking at this. In fact, if you go to the CDC's own website, remember, we were told that the 21st of January was the first case in America. But look what they're doing now. If you look, it says January 21st, but they're saying, you know, the impact moment or the moment of contact where you got the illness, look where they're listing it. They're now placing the first cases on the 14th. So the CDC is now backdating and showing this echo. They're saying, yes, this is what we knew, but you've got to go back 7 days. Now, that's a very conservative number, 7 days, especially when most of the scientific community is looking at perhaps a 14-day period where you're asymptomatic and don't know that you're now infected. But here's why this is important, and I need you to pay attention here, because this is modeling that I think you're going to start seeing more thoughts like this that are going to tell us a very different story. Since the CDC is backdating at the moment of, onset, not of actual infection, then we have got to say that all of these graphs have got to shift by 7 days. Why is that important? Let us show you the numbers at the CDC if we backdate it the 7 days. We take what they're saying and we go by the daily report. This is what this looks like. Okay, this is now starting, as you now see, earlier, and then we are coming across, right? We have moved everything back. We see the dates of impact. Now, what this does is, what this shows you is, if we're looking at a 1-week incubation period, this was going up. We had all of these people that were being infected and having an onset. Well, right here, this right here is where we started talking about social distancing, meaning we're going to walk amongst each other, keep our 6-foot distance. That started taking place on the on the 16th of March, okay? This is when we did this. Well, look it. We were already at our peak. We were already right there. Remember, what we were looking at was over here, but we've now looked at the incident, not the shadow, not the echo over here. If we look at the real moment of impact, it looks clear that we had already, and these are all the real numbers. Look, it doesn't keep going up. Once we start social distancing, we've flattened out. And you know what this red line here is? This red line is when we started our lockdown, after we've already plateaued in the numbers. You see, these viruses work just like Knut said. It goes up. He said if we just left it alone, this thing would have just taken another couple of weeks, and then it would have gone away. And we would have this great bonus of herd immunity. But instead, we started messing with it once we'd already peaked, once it was already deep into our population, and then we used this other issue of locking people down. Now, let me be clear. When you're looking at this now, this green arrow is where we believe these numbers could change. Beyond here, these may go up because, remember, we're backdating 7 days. Much of this information is still coming in. Again, I have no agenda. I'm not trying to, do anything except show you what we are learning from these numbers. Now let's take a look at something different. This is 7 days. This is what the CDC is doing, is they're backdating 7 days. But what if we went by what most scientists around the world are saying? It's a 14-day incubation period. And then you can do models based on 12 days and 10 days and everything else. But let's look at the difference in the 14-day incubation period. This is what happens to your graph. At 2 weeks, we realize if we backdate and imagine that this is the moment of onset and the echo was over here, look what happens. This shows us that this is how many people, and by the way, you're seeing these articles come out of California right now. We're wondering if we got the dates right, if maybe people were infected earlier. Is that why we're seeing lower numbers? See, we had already plateaued. This thing was working itself out. And again, even more dramatically, if it is a 14-day incubation period, this is when we started social distancing, long after we'd plateaued, still plateauing, and now, based on this graph, we might be going down before we even started the lockdown, because what we were seeing in New York is right here. And this explains, in many ways, why all of these models may be off, why just last week they said it's going to go on the incline, we're going into the dramatic effect. No, because you were looking at the wrong part of this. You were looking at the echo numbers of the infection numbers, not of the dates of onset. You see, good science does this a totally different way, and we're starting to move in that direction. Let me remind you, we don't know that it dropped before we got to the moment where we started to lock ourselves down, because after this green line, this data could still be coming in. We're still collecting this data. So these numbers may go up. They may get flat. We don't know. But what I'm trying to show you is, even though Cuomo and everyone around the world is saying, oh my God, we're going to run out of ventilators, the models are showing us it's going to keep going like this. It never did. It never did. And this might be explaining to us why. Now remember, Italy still saw its numbers going up after they locked down. We did not. Maybe we got in a little earlier. But here's the question. The question is, did we, in fact, hurt ourselves? Would we have stayed plateaued here, able to handle all of the people in the hospital? And by the way, right now, we might just be finally treating these people the right way and putting them on oxygen instead of ventilators and actually saving them instead of killing them. And if that was the case, then all that would really be happening, as Knut pointed out, is we would be having school children immune, people that are working having herd immunity. And when we think about herd immunity, if China has herd immunity now because they already got this thing, and all we did was keep us from getting to that herd immunity point, so that if Donald Trump opens it back up, we're all going to get infected again because it's still floating around, because all we did was destroy the possibility of herd immunity. Do you see the implications on a world scale that this is going to have? Do you see how bad it will be to have China ahead of us, back out and working and perfectly healthy, when we have to ask, are we going to just keep quarantining ourselves on and off? Remember what Knut said. The only reason we're going to have a second surge is if we did the wrong thing and stopped ourselves from getting to herd immunity. It almost sounds like that was the plan, to not have herd immunity. Interesting. I think I heard Dr. Fauci say exactly that.
We go through multiple cycles of influenza. There's always a degree of background immunity in the population. I mean, that will ultimately happen if we get a situation where we get back to normal. Now, I hope we don't have so many people infected that we actually have that herd immunity, but I think it would have to be different than it is right now.
I hope we don't get to that herd immunity. Are you kidding me? Is that actually a goal of the medical professionals right now? And why would that be the goal? What else is there other than herd immunity? Is lockdown? Is quarantine? That's the only other choice we have. So are you saying you don't want herd immunity, Dr. Fauci? That you don't want to follow in China's footsteps? We want to stay locked down? No, instead of hearing about getting out there, getting schools back online, doing what Sweden did, do what Austria is now showing that worked out, in Denmark, that are all getting back online, in China. No, we have this other approach, and you're trying to tell us it's the right way.